Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Podcast, a podcast exploring all aspects of children's palliative care around the world. Sunflower Podcast is bringing curiosity, humor, and reflection to the world of palliative care. We're exploring the joys and challenges of working in this incredible field, including topics related to education, advocacy, self-care, service provision, and leadership from around the world. My name is Rachel Neufeld, and I'm thrilled to be here as a guest host for this podcast. I'm a pediatric palliative care nurse practitioner in Vancouver, Canada, working for Canuck Children's Hospice. Join me in a 3-part series, Through a Nurse's Lens, where I talk to 3 nurses at Canuck Children's Hospice, each with a unique experience and perspective. We talk about the pearls and pitfalls of this beautiful work and how each perspective changes how we approach our work. Today I sat down with Melanie Hameluck. She's a nurse at Canuck Children's Hospice and also a nurse on the Oncology unit at BC Children's Hospital. We talked about how her experience in palliative care has informed how she cares for children and families going through their oncology journey. Hi, Melanie. Thanks for joining us today. I wonder if we can start with maybe just introducing yourself and your role.
So I'm Melanie Hameluck. I'm a nurse in Vancouver, Canada. I actually work in pediatric palliative care and pediatric oncology, hematology, and bone marrow transplant care here in Vancouver at Canuck Children's Hospice and BC Children's Hospital. For the past, it's been since 2016 that I was a nurse. I've worked mostly at Canuck Children's Hospice as a bedside nurse. And recently I started a role on the oncology unit as a clinical resource nurse. But most of my career has been as a bedside nurse in pediatric palliative care and oncology care.
Awesome. Thank you so much. I would love to start with just hearing from you about what drew you to pediatric palliative care. Like, how did you find yourself at Canuck Children's Hospice?
So I'm going to tell it a little bit as a story, because of course I could tell you all the things I love about pediatric palliative care, but really when I was in nursing school, I had some exposure to pediatrics, which I really liked. I had a lot of background working with children with different abilities growing up. And then I had a short practicum in palliative care. And it was during that time that I realized in palliative care, we really focus so much on the whole person and their whole story, including their family, the people they love, what they've been through. And I just really loved the holistic aspect of palliative care. And I thought, oh, maybe I might want to do this one day. But I also really liked working with kids. And at the time, it seemed like, wow, I can't combine both. That seems really intense. But for my final practicum, I went to West Africa. I went to Ghana specifically and traveled around the country working in different clinics and hospitals. And during that time, I was exposed to some children who were in pretty critical conditions and, not having much time left. And I did support one family who unfortunately had their child die in a matter of days when they got really, really sick. And witnessing that and, trying to advocate for the child and see the team do everything they could, but really struggling to find the resources and the experience or knowledge of, what can we provide this child and this family to make things easier on them was a lot to witness at the time. And I just thought, oh my gosh. But I kind of went, back to the guest house I was staying at that day after witnessing that and supporting that family. And I thought, I know of this place, Canuck Place. It exists in Canada. I read about it in my nursing textbook. And I know that they do a good job of this and they're experts and they know what they're doing. And I just thought, I want to make this easier on parents. I want to find a way to learn like what I can do to help these really like something that no parent should ever have to go through be a little easier.
Mhm.
And it kind of just ignited this like desire for me to come to Canuck Place one day and learn pediatric palliative care. And I was very fortunate to start working there about 7 years ago.
Yeah, that's such a good story because I think that I've used a similar explanation when people ask why I do this work. And I have used a version of that to say, unfortunately, the circumstances exist that children
Mhm.
cannot be cured, and these children will die. And our job is to ease suffering in that and to try to improve how that goes because I have also witnessed when it has not gone well and
Mm.
that our work, we get to actually try to make that a little bit better. In the times where we can't fix it, we can't cure it, we can't take it away, we try to reduce the suffering and make it a little bit better.
Yeah, exactly. Exactly.
On that note, I wonder, having worked in both palliative care and the oncology now, if you might give me a little bit of, the roses and thorns or the pearls and pitfalls, what are some of the good and the bad of working in pediatric palliative care?
I think for me, simply, the worst part is, like we said, that it exists. Like, I wish that we didn't have jobs in this. It's just not really something that people should have to go through. But I think in the grand scheme of things, as a pediatric palliative care nurse, my job is to make children comfortable and to make things easier for families. And the hardest days are when a child is very uncomfortable or a family is really struggling and I'm trying all the different things and I'm really doing my best, but my best maybe doesn't feel like enough. Like I'm not, didn't quite get them as comfortable as I wanted to, or didn't quite accomplish all the things that I wanted to in that day for that family. And yeah, I think that is probably the hardest part for me is as a nurse and the palliative care part. And having been someone who works in both the oncology unit and at the hospice, on the oncology unit, some of the hardest days are the days where breaking bad news happens, which really means that a child has gone through so much. They've received a lot of treatment, whether that be chemo or radiation, that has done a lot to their bodies. And the hope was that it would cure their cancer, but we've seen progression or scans that have told us that unfortunately it hasn't cured their cancer, and parents are either given options of perhaps trying a little more chemotherapy or treatment, or they're told that there really isn't any options left. And those days are really heavy. And, I hope that from those days, I can still support the families to either make decisions or just talk about it and have those conversations that might guide them. But it's just honestly, it's just really sad. And to witness, that change from the families being so focused on treatment, 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 and then being told the most devastating news they could ever hear. That's just really, really hard.
I'm wondering if your palliative experience informs now how you are a nurse at the bedside, like with those patients and their families in the oncology unit, in those meetings, those really tough meetings. Have there been things that you've learned in palliative care that help inform how you function in that oncology role?
Absolutely. I think that because a lot of my pediatric background has been in palliative care, working in oncology, it's made me realize how important it is to give the time and the space of being present, but also not be afraid to initiate difficult conversations. I think when you work in the hospital as a nurse, sometimes it's so easy to get focused on the tasks that we have to do and the meds that we have to give. And, when a child's uncomfortable, we're thinking, okay, we got to give meds, we got to do this, we got to do that. But sometimes discomfort is also psychological, and we do the best that we can. And it's sometimes there are so many tasks that it's hard to find the time to have conversation. But sometimes it's also just a matter of being brave enough to walk in the room and after having those big, difficult conversations and just say, wow, you've received some really hard news today. And just pause and wait to see what the parents hear. Sometimes I think people might walk in the room and immediately say, I'm so sorry. But I think it's important to kind of give those opening statements to see how the parents are reflecting and just be there and be present and not be, touching the IV pole while you're saying this or trying to do tasks, but really just sit or stand if you need to, but be present in that room and allow them to discuss it with you. Because quite often, when you're working in oncology, we've known these families for multiple months or even years sometimes. And we've witnessed their journey with them. So, to open up the floor for parents to talk to you about what you might think or what you've seen, and for you to reflect back to them about how much you've seen them go through, and the child too. I think it can be comforting to parents, but it can also provide them with a space to just really discuss everything that's going on.
Yeah, I'm hearing the elements that I've learned as well about active listening, right? Where we're
Mm,
making reflective statements to align with the family. Like you said, wow, that was a lot, or that was really hard news that you heard, where it's non judgmental. You're not putting any kind of bias on what just happened, but
mhm.
aligns with them and allows them the opportunity to share more of their experience so that it isn't our assumption of their experience, but you're providing a space of active listening for them to share a little bit more, which is one of the pieces of communication that we try to learn and teach in palliative care for sure. And I'm curious if you've had any specific experiences, or do you have any stories that come to mind of maybe when or how that has shown, a bit of a positive response, or that you've been able to really connect with a family in doing that?
Yes, so two stories come to mind. The first is actually an interesting one because I remember caring for this teenage boy who had a very, very rare cancer. And he had gone through chemotherapy with us. And I think he'd been with us for about 5 months at this point. He'd grown very close with a lot of nurses, was this really hilarious, awesome kid. And, during the last few weeks of caring for him, he started being quieter. He kind of stopped talking to everyone except for perhaps maybe his mom. He would still try to maybe give us a little smile here and there, but I think he knew that his body was struggling and that things were changing, and that perhaps the chemotherapy wasn't doing what it should be or what we hoped that it would do. And they did do some scans. He started getting more sick, and they did some scans which showed that, in fact, the cancer had grown and it had become more difficult to treat. And then a family team meeting happened with his oncologist, and I actually wasn't present for the meeting, but I knew what was being discussed. And what was being discussed was they were given an option of a research, like a trial that was happening, and they were given that option or the option to choose to do comfort care and just focus on living and being comfortable for what time he had left. And when I went in the room afterward, his parents actually stepped out for a bit, and I was looking at him and I was talking to him, just reflecting. Again, like I said, he hadn't really been talking to us, but when I was in the room, I still talked to him. And when I was doing his care, and he was watching some music on the TV, and I just started to reflect about the music he was listening to and how it was emotional and, beautiful. Anyways, all of a sudden, he just looked at me and he started talking for the first time in weeks. And he just looked at me and he said, "I'm terrified." And then I looked at him because it just out of nowhere, that was the first words he said. And I didn't respond right away because it was such a powerful thing to hear from a teenager. But I just basically took a really big, deep breath and I sat down on his bed because I thought, wow, this is big. And I said, wow, like you're terrified. And he was like, yes. And he's like, I'm so scared right now. And I said, can you tell me why you're feeling scared? I heard a little bit about that conversation that you had. Is that what you're talking about? And he said, they told me that I have a choice. There's this research trial and there's the choice to do nothing. And I said, well, and I said, can I tell you a little bit about the doing nothing part? And he was like, sure. And I said, well, it's not choosing to do nothing. It's really just choosing to make sure that you're comfortable. And if there's some things that you want to do, with your brother or your family, we can try to do those things because we don't really know how the medicine from that research trial is going to affect you. And we don't know how it's going to make you feel. It's really important as a team that we give you that option, that you don't have to do that research trial. If you feel like your body's been through enough, then that's up to you. And so it was a few years ago. So I don't remember the specifics exactly, but I remember just in that moment, I felt like we continued to talk and talk about it. And he really was just telling me that in the end, he decided that he really, really wanted to try the trial, but to give him that space to actually ask his questions. And I remember he also, I think one of the reasons he chose to talk to me in that moment is because his parents weren't in the room. And he was feeling that intense guilt of being like, well, like, what do I tell my parents if I don't want to do it? And, I have to do it for that, and we reflected a lot on that. And I think the big, like, key piece that I'm trying to get across by telling this story isn't so much about what I said or how the conversation went. It was more about providing that space. And so instead of just going in the room and hanging his meds and doing my little nursing tasks, I actually just lingered in his room and reflected on what I was seeing and tried to make comments and connect with him, even though he wasn't really trying to connect with me. I just provided that space. And in that moment, I felt extremely honored that he took that space I provided and went with it and let a lot off of his chest, because I could tell that he was going through so much more than physical pain, but that psychological pain that we talk a lot about, and total pain that we talk a lot about in palliative care. So
Yeah.
yeah, that's a story I'll pretty much never forget.
Right. I feel like that's such a good example of how nurses can use those communication skills and approaches at the bedside because I've heard nurses question, when they're doing serious illness conversation training, for example, or when you hear about breaking bad news, nurses often think, well, that's not me. I don't do
Mhm,
that. Those are not the
mhm,
conversations I have. And this story is such a good example of how a nurse can use the same skills and the same approach to active listening and creating the space. And also, the way that you respond with more questions is so good for how nurses can actually provide that support at the bedside, or in clinic or in the hospice, all those different settings, because I think nurses feel like they don't necessarily have those conversations. And I think this is exactly the kind of conversation that you do have. And it's often, the quiet of the night, or you're exactly right, when the parents leave the room, that nurses are faced with these big questions from patients and from families as they really think about what is most important to them. I,
mhm,
I love that example. I wonder if there's also maybe a couple other examples of how you've pulled some of that palliative approach to the hospital, maybe, and how that approach decreases how hospitalized that can feel for families, maybe. Or I know that the approach to symptoms is a little different in an acute care setting like a hospital, and maybe some of those places or areas where you've been able to take your palliative experience and adjust the way that you've provided care at the hospital?
mhm, mhm. Yeah. Before I go into that, I also just wanted to make a quick comment about how sometimes when we aren't a part of those family team meetings, it can almost benefit nurses who are at the bedside to have those conversations because we can ask questions.
Yeah.
Because you can choose to assume that the parents know that you know, or vice versa. However, you could also just say, okay, I know some information, but I'm going to go in this room and I'm just going to ask the parents,
Mm-hmm.
how did that conversation go? What did you find out? And sometimes that can actually be a really good tool of starting those conversations because you weren't there, and it's a way of getting them to start talking and connecting, and you can reflect in whatever way you want. But yeah, sometimes actually not being present and not knowing everything can give you a lot to go with, and just remembering to not be too scared to ask, because if you ask and they don't want to talk, that's fine. But
Yeah.
if you don't, then there's no space being provided for those difficult conversations where they might really love talking to a nurse who really, really knows their child.
I love that. And clearly also your approach being coming with curiosity, right? So then
Mm,
you come with curiosity, these parents to say, I'm really interested to hear from you how that went. What was your
mhm.
experience? What did you understand about it? Those kinds of curious questions are so great to really open it up for parents to be able to share instead of assuming that because you heard the healthcare provider's perspective. I love that.
Absolutely. Yes.
Yeah.
Yes. And then moving on to your last question about the environment of being in a hospital. Because again, working at Canuck Place, it's totally the environment that we can provide there is much more like a home based environment with meals and so many resources. At the hospital, it can be really tough to go from changing it to when a family does make the loving decision that they want to focus on comfort care. Sometimes it can be hard to make that room feel less hospitally, I like to say. In the past, we've done different things when the kids are in the hospital and they've chosen to stay there for their comfort care, and how we can make that feel a little bit less hospitally. There's a lot of little things that we can do, but I'll sort of tell some stories and examples of what I've done in the past with families to try to make that environment more comfortable. First and foremost, I think about whether this family is a family that likes to be close and cuddly with their child or teenager. And in that case, if there's another bed available, and putting two hospital beds together, putting the middle rails down, even though it might be a little lumpy and bumpy, stuffing some blankets in between the two beds to make it kind of one big king size bed with as many cozy things as possible can be really nice for families. So they're not having to, sit on a hard chair right at their child's bedside all day long. Just making sure that parents are still comfortable. And also on that note, the parents meeting their own needs. I've seen a lot of moms and dads who stop eating and drinking, and I completely understand that it's very human when you're going through something so difficult and stressful to kind of stop feeling those natural needs. But as a nurse, trying to do the best that we can. Again, in the hospital, we don't have that many meal options or whatnot, but grabbing little snacks, making sure there's always water in the room for them, or even tea or coffee or whatever we have access to, even if they're not asking for it, which most of the time they don't, just having it available. So when they have those moments of need, there was one mom, she had this toddler who had changed so quickly overnight. And that day she required very intensive symptom management. And we were so focused on her and getting her comfortable. And I think there was a lot of, adrenaline between mom and dad and me, and just trying to do everything we can to get her comfortable, that by the time she really was comfortable and lying in mom's arms, mom looked at me and she was like, I think I might faint, because she'd realized she hadn't eaten or drank or done anything for herself in so long. And so immediately I ran out, got her juice, and just put a straw right there. And I was like, you need to drink this. She didn't feel like eating or drinking, but what we need to remember is it doesn't feel like they need to do that stuff in those moments. But if we can do anything to help parents be more present with their child during those precious, precious moments, we need to do it and try to help them take care of themselves too, so they can be as present as possible and have those memories and be with their child during those difficult moments. I think with the environment, there's little things you can do other than the bed, changing the lighting in the room so it's not all bright hospital lights, turning some of them off. Sometimes families might like to have like a little nightlight or twinkle lights or something instead. Having all the child's favorite stuffed animals surrounding them so they look nice and cozy. Those things are all ways that you can change the room. Or if the family or child is some people who like music, sometimes in those moments, we're not forcing anything on them, but they're so focused on just being here and now that you can get so easily caught up. But just prompting them to say, like, do you think that so and so would like to have music playing right now in his room, can be just a way of helping them also create an environment that they like. It's dependent on them, but just asking those little prompting questions to see, because they might not ask, because they might not even think that's an option, or they might just even forget about have forgotten that music exists for the past 5 hours because they've been so focused on their child. So little things like that, I think, can go a long way. Even sometimes the outfits the kids are wearing. It's also key to have the siblings and the parents involved in the care as much as possible if they want to be, because during these, weeks, hours, days, there can be a lot of helplessness, and especially if their kid's no longer eating, and that's a big way that they provide for their child, or that's kind of like their love language. And they can no longer eat or drink bottles or breastfeed, finding different ways to get them involved in the care, whether that just be simple mouth care or repositioning or helping them be cozy or washing them. I think that's also really important. An example of that is I had like a teenage girl who painted her sister's toenails during the last days of her sister's life, just to feel like she was doing something for her sister, and giving them the options to get fresh air if that's possible where you were, to go on a patio, take the whole hospital bed if you need to, so the family can have a different environment. And then another thing I also will prompt families with is there anyone else who really loves your child or loves you guys that you would like to be present during this time? Because again, sometimes they're so focused, they're not on their phones, they're not, these thoughts maybe aren't crossing, and just asking them in case, there are people, but they're just not thinking about it in that moment, can be really helpful to them, because they might go, oh yeah, like my parents, like I really want my parents here. Like, yes, I should tell them to come, can be really helpful as well.
Yeah, I love all of that. And I'm thinking about the questions as you're talking. Questions like, what does your child love to do? Or what brings your child joy? Helps you identify those things, like music versus stuffies versus, what are the things that bring the child joy? And then what are some of the experiences that are so important to you as a family? Help you identify those things, like perhaps getting outside into fresh air. Perhaps it's having music playing. Perhaps it's something that you're playing games or things that bring the family joy. What are those experiences that you can help facilitate for the family to participate in? And then who else would you want to have here? Who else is important to you to be present? So I love those as cue questions to ask the families that really enhance their experience when they are so focused on those last hours to days, when time is short. I think those are actually really beautiful examples of how we can add care that doesn't require a lot of medications or medical training. These are just really thoughtful, compassionate ways to care for a family.
Yeah, it's truly just walking people through a journey that they never thought they'd have to go through.
Yeah.
One time, I think as you were saying that, I was just thinking about, like, what brings their child joy. And I think sometimes even having the siblings do those things in the room, like I will encourage too, even if it's video games, because, if their brother's not having as many wakeful periods anymore and he's comfortable, he's in bed, but he can't play the video games, like having the siblings do those things can be, you're creating an environment that child would love, right? In
Exactly.
that room. I'm
And
just
having
thinking about that.
experiences together.
Yeah, and I know a family once who played a lot of Hawaiian music and made the
Mm,
room very like sunny, open the windows because they said, well, our son really loved Hawaii. And during his last moments, they really tried to create like the most Hawaiian environment they
I
could.
love
And I
that.
thought that was really beautiful.
So good. Melanie,
Mm.
thank you so much for taking the time to chat with me, talk about your experiences. You had some really great stories to highlight the kind of work that you're doing and giving nurses a perspective and a voice in how they can really do this care, no matter the setting, that cares for families and their children. So thank you so much for spending time with us and sharing a little bit of your world.
Thank you for having me. That was really nice to talk about. Thank you.
Thank you for listening to this episode of the Sunflower Palliative Care Podcast. These podcasts grew from a seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related issues. To learn more or to donate, please visit twoworldscancer.ca.